Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Thank you all for coming here. Today, I'm going to talk very briefly about one of the most common problem, that is a cough. And we see this common complaints made by patients all the time. And I'm going to talk to you in a very simple way. I would like to avoid any medical terms. So make it very simple as much as I can. If you have any question, please do not hesitate to interrupt me and ask me any question. And I thank you, Deborah and Washington Hospital, for inviting me here. Over the next 40 minutes, I'm going to talk about the cough. Before I talk about the cough, I just want you to be familiar with some of the common things, what called anatomy, or the structure of the airways and the lung. And just a brief explanation of how the lungs and upper airways work. If you look at this picture, this is the picture of the sinus and the nose. Our nose is lined by a small, delicate, very thin, delicate skin, or what is called mucous membrane. And if you look inside the nose, it looks like this. It's a very delicate lining, just like a skin inside the mouth, which is very different from the skin over here or the palm skin. This is not some kind of inactive structure. It's an active structure, which is very important for the defense, as well as also to protect it from some disease. So inside the nose, this is the lining of the nose. And if you look in the front, these are the sinuses. Sinuses are nothing but the hollow space inside the bone, which is lined by the same kind of mucous membrane. And they all are connected to each other. And this makes a part of the upper airways, where we breathe the air through the nose, it goes to the sinus, and the air becomes somewhat humidified and moist, and then goes down through the other air passage like a windpipe into the lungs. This is very important to understand before I talk about the cough. So when you go further down from the nose, the air goes to the voice box, and the voice box becomes what is called a windpipe, or the trachea. This is the one. This is the trachea. It's a small tube-like structure which carries the air from the upper airways, from the nose down to the lungs. As you go down, this divides into two branches, and that again divides into a small branch, like a branching of the tree. If you imagine a tree upside down, it's exactly like this. This is the stem, it goes down, divides into 2, 4, and it goes further down, becomes smaller and smaller. And at the end, what we see, this is this area called alveoli, or called air sac. This is a small balloon-like structure, which is at the end of the bronchial tube, where the real exchange of the oxygen and carbon dioxide takes place. And this is a little bit more magnified picture of what I showed before. This is the windpipe. This is the what is called a bronchial tube. It goes down, divides, and at the end it becomes like a bunch of grapes. And this is the structure of what is called alveoli, or the air sac. And these are the large bronchus, and this is called small bronchi, or a small air tube. Any questions so far? Am I going too fast or okay? Okay. Okay. Now, as you go down, further down, at the end of this thing, at the end, you see this is the end of the tube that becomes air sac. this is where exactly the oxygen and carbon dioxide exchange takes place. This air sac is surrounded by the blood vessels. So the red color is oxygen that goes in, passes through the air sac, goes into the blood vessel, and the carbon dioxide, which is the blue one, that comes out and we breathe out. So this is how the normal the airways and the lungs work. These all things are lined by the same kind of thin mucous membrane, just like we have in the nose and the sinus. If you look in the bronchial tube, the bronchial tubes are lined by this delicate lining called mucous membrane, and it has some kind of muscles and the cartilage to make it a little bit stiff. This is the schematic representation of what I told before. This is the end of the air passage, and that become the air sac, or called alveoli. These are the blood vessels. In the blood vessel there is a red blood cells. Oxygen comes from here, goes into the blood, and the carbon dioxide comes here and get out from here. So this is how normal breathing takes place. Now normally our lungs, we breathe about 15 to 18 times per minute. The air will pass through the upper airways, through the nose, sinus and the mouth, gets moisturized, and it will go down to the windpipe, to the bronchial tubes, into the air sac, where the exchange will take place. Now this is very important before we begin the real talk about the cough. The reason why we get cough, the lining which is inside the air passage gets irritated, either because of some kind of pollution or virus or allergies, and that will create a reflex which creates a cough. Now there are certain defense mechanisms we have inside the body, and there is one is the sense of the smell. This sometimes tells you against some kind of pollution, and these two are very important defense mechanisms. One is called cilia. It's a very thin, tiny hair-like structure which we cannot see with your eyes. It's only seen with the microscope. It's in the mucous membrane called the lining of the nose. This sweeps the mucus away. So the mucus will gradually sweep away from the nose, from the sinus, and it goes to the throat and goes into the stomach where it's absorbed. And this structure gets damaged because of allergies or the cold, and then the mucus gets stuck into the throat and sinus, causes some other problems. And mucus in the lining is also very important. It will trap some of the particles, the bacteria, virus or the dust, and it will expel it out with a cough. So coughing, sneezing and this swallowing, these are all kind of our defense mechanism that helps to counteract against some of the bacteria, virus or allergens. Now let's talk to the real thing. What is cough? The cough is one of the reflex mechanism inside the body to protect us from certain disease or prevent certain infection or bacteria or virus going down into the lungs. It's just like it's a reflex made by the nerves. Like when we touch any sharp object or anything hot, we reflex to take our hands away. It's done by the nerves that goes into the brain, and the brain sends the reflex to pull your finger away because it's hot or it hurts you. Same kind of reflex. Anything that goes into the irritates the lining of the airways or bronchial tube or lung, that will create the reflex, so the body will cough it. That way that can be expelled out. It's a good defense mechanism, but at the same time it can be also one of the factors in the spread of the infection. If somebody has a virus or cold or any kind of flu, the virus can be sitting inside the back of the nose or the throat, and with the cough that can be spread to different people outside. Now occasional cough is normal. We all have cough once in a while. It's a defense, but when it becomes persistent or annoying, interferes with the life, daily activities, that becomes abnormal. Now, excessive cough could be manifestation of some kind of respiratory or non-respiratory condition. There are many things that can create cough. The cough is not a disease, it is a symptom. It can be because of something very simple, very trivial like cold or allergies, or it could be because of something very serious, sometimes pneumonia or TB or lung cancer. And it is one of the most common reasons why patients come to the office, just like a back pain, headache and cough. Those three are the few of the most common reasons why patients visit doctors. Now, when we see a patient who complains of cough in the office, first we go through very systematic analysis, ask them the questions, and they are very important to arrive at the correct diagnosis. Because we don't want to subject people for doing too many unnecessary tests for some simple thing, which mostly resolves by itself, like allergies or common cold. So what we try to do, we try to take a very detailed history about the cough. Ask the questions. First thing, how long do you have a cough? How did cough started? Did you have a cold, runny nose, sneezing, allergies? Do you have any fever, headache, stuffy nose, heartburn, breathing difficulty, fever, weight loss? So ask them many questions and then try to come to a possible diagnosis and then work accordingly. Some of the things are very important in the history when we ask. One is the smoking. People who smoke, they have the chronic cough many times, and that is called chronic bronchitis. And most of the smokers know that this cough is from smoking because they have a lot of mucus production, and that something is this mostly is chronic, goes on for years or months. The second thing, certain occupation, people who work with cutting some hard metals, or they work with some kind of spray or irritants, that they have chronic cough. So those history is very important to arrive at correct diagnosis. The one most common thing we see nowadays in the office is a cough because of some medicines. Before we subject a patient for too many tests or too many investigations, we make sure they are not taking certain medicines that cause cough. And one of the most common medicine nowadays, I am sure some of you are familiar with, some of the blood pressure medicine. It's called ACE inhibitor medicine. Some of the common generic name is called lisinopril, Vasotac, or Ramipril. These are the medicine that causes dry cough, and if the patient is having a cough for last couple of weeks or months and they are on this medicine, the first step we do, ask them to stop the medicine. If the cough is from the medications, it should go away in about 2 to 3 weeks. And 90% of the time the cough goes away and we can avoid doing any other test. So the history is, again, it's very important because there are not too many tests to confirm the diagnosis many times. No objective test to diagnose, so many times it's very subjective. So again, after we have an initial history or some data, we do appropriate testing, and those tests involve X-ray, breathing test, or sometimes the blood tests. Now, the cough is divided into three categories, and this is the estimating the duration of the cough is a very important first step in narrowing the likely potential causes. The first category is called acute cough, and this is the most common reason for cough. Acute cough is less than 3 weeks. Subacute category is called between 3 to 8 weeks, and the chronic is anybody has a cough lasts for more than 2 months, which is called chronic cough, because then the reasons are different and we have to work them with different kind of tests and they might need different medications. The chronic cough can be sometimes very annoying thing, and it's very frustrating for the patient and for the doctors. Many times we can fix the thing completely, but what we do in that situation, we try to reassure patient that this is not because of something serious like a cancer. That's the most worry people have. Do I have a cancer? Do I have a TB or pneumonia? So, by doing the right kind of test, we can at least reassure this is an annoying problem, but it is not from something serious or life threatening. It will go away with the time or get better easier. The most common cause of acute cough is what is called post-nasal drip syndrome or upper airway cough syndrome, they call in medical term. This is a little bit more, little bit technical thing, but I will try to make it simple if I can. As I showed the picture, the first two pictures about the upper airways, the nose and the sinus, they are lined by this thin lining called mucous membrane. Now, in the mucous membrane there are some glands. They secrete mucus, which is a liquid that will trap the irritant particles, bacteria or virus, and it will clear up, slowly clear up towards the throat and goes into the absorbed into the stomach. Now, in response to certain irritants, the nasal glands that will secrete or produce large amount of mucus, and that mucus and the mucus will become kind of thick and sticky, and that will tickle in the back of the throat and makes you cough. And this is a very common symptom. Most of the patients present, they say, oh, I feel like I need to clear my throat every 5 minutes. When I talk, I start coughing, and when I try to do something, I start coughing, and I have to clear my throat, goes away and comes back in about 15-20 minutes again. So this is a typical called post-nasal drip, and the most common cause of post-nasal drip are common cold. This is the most common, and the allergies, sinus infection, and some irritants like pollution. When you go out in a place where there are a lot of pollution on the road or the atmosphere, that will irritate the lining of the nose and produce lots of mucus, and the mucus will tickle back of the throat, make you cough. This is not serious, this is benign, annoying, but it goes away. Most of the time they don't need too many medicines to treat, but many times patients get kind of impatient. They go to the pharmacy and pick up some of the cough medicine. If you look at, this is what exactly happens inside the nose. The lining of the nose become inflamed and a lot of mucus is being produced. That mucus is like a micro droplet. You don't see a big amount. For some people, the mucus comes out through the nose in the front. Sometimes it gets stuck into the sinus, and many times it can tickle the back of the throat. So there are three ways for mucus to go. Everybody is different. Some people never get runny nose or stuffy nose, they get just a cough, and other patients have only runny nose. So this is called post-nasal drip, where the mucus over here, it tickles in the back of the throat, and you feel the tickle. Now, besides cold, the allergies is one of the most common cause of this tickle in the throat or cough. This happens very common here in this area around the springtime is the most common time, or sometimes in the fall. And there are four most causes of allergies. For one is the pollens, that happens more in the springtime. The second one is the mold, which are very unusual in this area. Mold is more in the areas where the weather is very humid. You go in the Midwest, it's very hot and humid weather, there you see a mold in the basement, and that can cause allergies and post-nasal drip. Dust mites are very common problem. In the house or in the bedroom, we have so many curtains or mattress or sofa. It collects a lot of dust, and there are some kind of mites, they multiply there, and there is a chemical from the mite that causes allergies when you breathe it. And the fourth thing is animal dander. If you have a cat is the most common thing. Cat dander is one of the most common reason why you get allergies. So these are the four most common reasons of allergies. And allergies can trigger post-nasal drip and cough. This is again the same thing about the allergies, how this happens, and the common symptoms for the allergies. See, these are the seasonal thing. The pollens and the molds, they are seasonal, and these are all around the year. Dust mite, animal dander, and mold. So some patient complain their runny nose and coughing never goes away, and that could be because of dust mite or animal danders. and it's very hard to convince somebody to get rid of the cat. It's impossible. Now the treatment for the post-nasal drip. When you go to the local pharmacy, go to Walgreens or CVS, you look at the medicine. There are like thousands of medicines. It's so confusing what to take. And I'm trying to make it a little bit easier to understand what medicines are really useful and which are not. Because when you go there, you get totally confused. I went there one time, and I was kind of confused what to buy there. Because there are so many different kinds, so many different combinations, different price, and some of them are actually harmful than helping you. And lots of commercial marketing thing also a big factor. You look on the TV or internet and people end up buying those medicines. There are four major group of medicine that we use for postnasal drip. The one is called mucolytics. You might have heard medicine called guaifenesin. It's one of the common medicine. It makes your mucus thin, so the mucus can be expelled easily and clear up from the throat. Let's go back here. Yeah. So it comes in different strength. It comes in 300 milligram, 600 or 1200 milligram. The effectiveness is kind of questionable. For I can say about 40% of the patient the medicine works, other 60% doesn't work. It's a placebo kind of thing, but it's benign. It doesn't harm. That's a good thing about this medicine. It doesn't harm, and sometimes the pills are so big some people don't like it. It's like a horse pill, the biggest medicine you can ever see. The second group of medicine is called antihistamines, and these are very, very popular medicine. If you buy any cough medicine or cold medicine, it's one of the most common ingredient. And the antihistamines are the medicine that will decrease the production of the mucus. And once the mucus production is decreased, the postnasal drip will decrease. One of the most common side effect, it can be very drying and make you very drying and sedating. You must have heard some of the common sleeping pill called Tylenol PM. One of the common ingredient is called Benadryl. Everybody knows Benadryl. The Benadryl or other medicine called chlorpheniramine maleate. This is the same group of medicine. They are called first generation antihistamine. They dry up the mucus and cut down the postnasal drip. They are very effective many times. But the two most important thing, it can be very sedating. So if you have to go to work, drive, it can be very dangerous. It also extremely drying, so makes some people feel very uncomfortable because of the drying effect. The second generation of antihistamines are less drying. They like a Claritin, Allegra or Zyrtec, and they are less sedating, but they are not very effective for the common cold kind of thing. For allergies, they might work good, but not for the cough because of the common cold or chronic cough. The third group of medicine is decongestion, and this is very uncomfortable for some patients. When they get the cold, they get stuffy nose. They don't get runny nose or they don't get any fever, but they get severe stuffy nose because the lining of the nose become inflamed. It will plug up the sinuses, and it's such an uncomfortable feeling, and it makes you so uncomfortable you can't sleep at night time because you can't breathe through the nose. And in those situations, they need is something called decongestion. The antihistamine do not work. Now there are so many different decongestion on the market. The most common is called Sudafed. It's one of the medicine that comes in combination with different antihistamines and guaifenesin. The real Sudafed right now is difficult to find in the pharmacy. They give you something called phenylephrine. This one. This doesn't work. They took off this from most of the over-the-counter medicine, Sudafed. You have to go inside the pharmacy, and pharmacists will make you sign a paper. Then you can buy this medicine called Sudafed. When you combine that with other medicine for the stuffy nose, it works the best.
Why all that problem?
Because people are you know, they used to make those what is called street drugs to go high. What is the most common there? It makes you methamphetamine. So that's why they took out the market. A lot of young people used to use it. You buy the over-the-counter cough and cold medicine, which has a Sudafed, and they make that amphetamine. One of the caveat with this medicine, it causes high blood pressure. If you have high blood pressure, do not take this medicine. It might raise the blood pressure up. And it causes sleep disturbance, keeps you awake, because it has something like a Sudafed, stimulates your brain. So many times they combine this with antihistamine, so it works out better. The antihistamine makes you sleepy, this will keep you awake. So basically you neutralize the effect of each medicine. Now the last group of medicine is called the cough suppressants. These are very popular medicines. People buy it right and left. These are basically, they don't do anything in reality. These medicines are almost like a placebo. It makes you feel good. You took some medicine for the cough, but in general they don't address the main problem why a person has a cough. And rather than addressing the main problem, they just suppress the cough. And there are many medicines over the counter: Robitussin DM, Robitussin CF, codeine, hydrocodone. They are all different group of medicine, and some of them are very strong. They are narcotics that make you sleepy, drowsy, constipated. The other remedies for the cough, these are in my opinion, this works better than anything else. These are simple, harmless, and works very effectively. Now, as you talk about the cough drops, what does the cough drop, what it does? When you take a cough drop, you try to put it inside the mouth, you get a lot of saliva. So all the saliva will go in back of the throat, and it will mix with the mucus, which is very sticky. It will make the mucus thin. So mucus will basically go down to the stomach easily. So that thing that was sticking in the throat will go away. Yeah, like sucking on a hard candy, the same thing. You create more saliva, or you drink a lot of water. You hydrate. That will make the mucus thin, so mucus can be cleared easily, and the cough can get better.
What about that saline ocean?
That's what I'm saying. Yeah, it says that. Yeah. The one thing, the funny called steam inhalation. When you inhale the steam, it basically clears the mucus from the nose and the sinus, and it becomes thin, so mucus can be drained much easily. Opens up the sinus. Same thing with the nasal irrigation. That's a saline. What it does, again the same thing. It will make the mucus thin, so the body can clear it much easily, and it will not get stuck into the throat, make you the tickle. There are all different kind of saline spray available in the market. One of the thing I like it called sinus rinse. You might have seen that thing. This is the picture over here. This is where what you do, you buy a big bottle, and you fill it with the water and put a small pack, which is like a sodium chloride, or basically a salt, which is which is processed, so you don't feel kind of burning inside the nose. And then you squeeze inside the nose, so the large amount of saline goes in the nose and sinus. It clears up the mucus very effectively. It's very cheap and effective way to clear this, to clean the sinuses and the nose.
And it's actually safer than all these medications, isn't it?
I'm sorry?
It's safer
Much safer, yeah.
than using all this medication.
Absolutely. It's a little bit cumbersome. Some people don't like it because they become kind of, you have to fill up the water and just go in near the sink. But it's very effective. So over-the-counter medicines are very confusing. Okay, as I told you before, there are too many medicines, too many different combinations, too much difference in the price, marketing. So most of the time you need some help. You can talk to the pharmacist there, and maybe you can describe them your symptom, whether you have more runny nose, cough, or stuffy nose, and based on that they can suggest you different combination. Now there are prescription medicines for the cough, and those medicines are basically same group of medicine but comes with a higher strength, and they probably last for longer time. Some effect lasts for 24 hours or 12 hours, and they are more expensive. So the most common we use is called Phenergan with codeine. which is a very strong medicine for the cough. It's very drying, constipating, but if you have difficulty sleeping at night time because of cough, that's a good medicine. At least you can sleep for the night. One of the most take-home message about this acute cough is that the most of the time antibiotics are not helpful. Many times patients come, they call us, so I need antibiotic. And it's so hard to convince that you don't need antibiotic. This thing gets better by itself. It's a viral thing most of the time, and it's a matter of time.
How long is time?
Now the next category is called chronic cough. This is the most common reason again for the office visit. And there are four most reasons for the chronic cough. One is the same thing as I told you, the post-nasal drip. Now some people have a post-nasal drip that never goes away completely, and that will linger with the cough for more than 2 months. And there are three other reasons for the chronic cough. The one is the gastroesophageal reflux, asthma, and chronic bronchitis. That we'll talk briefly. Now this is the same thing what we talked before about the post-nasal drip causing tickle and a cough. It's again from the allergies or some kind of virus or sinus infection. Sometimes you have polyp in the sinus or mucus gets stuck in the sinus. That doesn't go away for a long time. So you exclude some other reason. Make sure not a smoker, not taking blood pressure medicine, and no sinus infection. One of the category of most the reason for chronic cough is what is called gastroesophageal reflux. This is very common problem after a certain age. Anybody who has cough, new cough after about 55 or 60, lasting for more than 2 to 3 months, this is the thing to consider. Many times patients with this let me first explain what this gastroesophageal reflux is. Many times the acid from the stomach can go up into the chest, and it will trickle into the back of the throat and make you cough. Now most of the time patients do not complain of any heartburn, and that's why they get kind of confused when we tell them your cough is because of the acid reflux. They say, I don't have any heartburn. But you don't have to have heartburn. Sometimes the acid can go without causing any heartburn. It's what is called micro droplet that can go up to the chest, trickle into the throat, and make you cough. And this is a very common problem, and it has to be treated for a long time before you see the results. And there is no diagnostic test. Many times you can go for endoscopy or other tests which may not show anything. The bottom line, they have to take the medicine for the acid suppression for a couple of months and see the effect. The third category is asthma. There are many patients with asthma, they present only as a dry cough, which comes at night time without any shortness of breath or wheezing or any sputum production. So this is called cough variant asthma in medical term. Asthma is a condition that affects the airways. It does not affect the lung tissue, it affects the air passage. So any kind of thing that will trigger, trigger means they will irritate the bronchial mucosa. The bronchial tube, they go into spasm, and that causes wheezing and shortness of breath. So this is what happens in asthma. These are the normal bronchial tube, and these are the bronchial tube which become narrow compared to over here. So it's very difficult for the air to move back and forth because the tube is narrow, and that's what creates whistling sounds. And many times it doesn't create whistling sound but just makes a dry cough. The last category of chronic cough is chronic bronchitis. People who smoke, the lining of the bronchial tube become very inflamed. They produce large amount of thick tenacious kind of sticky mucus that gets stuck and make them cough all the time. If you look at this picture here, so this is the normal lining of the bronchial tube, which has what is called fine hairline structure called cilia that will, like a brooming, it will broom the mucus. And a person who smokes, what happens, this hairline structure become paralyzed, so it's not effective. It doesn't broom or clear up the mucus. Mucus builds up over here, and the mucus become thick and infected, and it get like stuck like this in the bronchial tube. So this the cough never goes away people who smoke. So the most important treatment is to quit smoking. Even if they quit smoking, the cough may not go away completely but get better after about 6 to 8 weeks. And lastly, I just want to emphasize about some of the common thing. Do not take your lungs for granted. You need to know about how the lungs work. This is the most important thing. Do not smoke, and contact a health provider if you suspect any problem. Particularly if you have the cough that lingers more than 2 months, you should see a doctor and let them do the right kind of test and figure out the cause. This is again the same. Questions? Thank you. Yes.
Could you comment on post-nasal drip and loss of sense of smell, taste? I realize it's not,
Yeah,
but
I think
related?
yeah, absolutely. So, you know, if you can't smell things, you cannot taste many times. So those things are interconnected. When you get a cold or allergy, sometimes your nose, the lining is kind of damaged or inflamed, and the nerves are not effectively working. So if you can't smell, you cannot taste the food. So when the nose get better, the taste get better. Yes. It does. Yes.
Can a hiatal hernia cause a cough? And if so, can that be corrected?
Yes. Hiatus hernia, it's one of the conditions where the part of the stomach goes into the chest. And the acid from the chest, from the stomach, it can go up into the chest and cause reflux, as I said about, and that can cause cough. Depending upon how bad is the hiatus hernia, there are different degrees and categories. If the small part of stomach is going into the chest, it is less likely to cause acid reflux and cough. But if it's big part that goes up in the chest, and acid will go up and make you cough. You have to take the medicine for the acid for a long time, couple of months or sometime for the lifelong.
Can that surgically be corrected?
Surgery is a kind of controversial thing. Many times the surgery doesn't work for some patients, and even after the surgery, they still have to take the medicine. The surgery basically try to bring the stomach down, or they can make it a little bit tighter, so the acid cannot go up from the stomach into the chest.
I've had problems with bronchial pneumonia and bronchitis, and that since the age of 2. I have a lot of times when I have chest x-rays, I have a lot of scars on my lungs from it. I take Robitussin DM, I have a nebulizer that I use, and none of it seems to help me.
Right. So when you have a scar inside the lung because of long-standing this injury since early childhood, right? Right, because that has damaged your bronchial lining, the bronchial tubes and part of the lung tissue. So that has created the scar there. So unfortunately, there is no medicine that works for that completely. It can give you temporary relief from the cough, but it doesn't go away completely.
I wake up in the morning and my tongue feels like a piece of sandpaper in my mouth.
Yeah. So that's kind of one of the unfortunate things. No medicine works very effectively. You got to live with that. I'm sorry, but that's a reality.
What do you think of the nose tapes to sleep with at night?
What tape?
The tapes that you put over your nose?
Oh, I tried myself. Yeah, it's very interesting. You know, it comes in different sizes, and I have a problem for many years with my nose. Gets stuffy at night time and when I catch a cold, and it depends upon how bad is the blockage inside the nose. If you have like a small amount of narrowing inside the nostril, you put the tape, it basically stretches the thing. So as I show you the picture of this, the nose and the sinus, there are structure called turbinates. That's in. Let me see the picture if I have it. You see inside the nose those things, this structure. It's like a shelf-like thing. It comes like this and hangs inside the nose. So when it becomes swollen, it will block the air passage. Like Actually, these are the terminators. This structure over here, and this is the area where the air goes in back and forth. So when this becomes big, it will block this area completely. So there is not much room for the air to go back and forth. So when you put those things, it basically stretches this out and try to create some more room there for the air to move in. Even if you can get 1 or 2 millimeter extra space, it makes a big difference. It's something benign, doesn't hurt to try. If it works, it's good.
Is NyQuil or DayQuil any good for coughs? I know it has side effects, and that's why I'm afraid.
See, the DayQuil has a 3 medicine inside. The one is I think it's something like a Tylenol. Second one is a cough medicine, and third is a decongestant. So most of the people, when they get a cough or cold, these are 3 most common things. They get a little bit of headache or pain, congestion, and cough. So when you take a DayQuil, it basically addresses each component separately.
Well, let's thank Dr. Vora.
Thank you very much. Thank you all for coming here. Thank you, Deborah, and thank you, Washington Hospital, for inviting me here.